Hi, folks. Thanks for being here with us today. I am Mauricio Tohen. I'm a distinguished professor and chair of the Department of Psychiatry and Behavioral Sciences at the University of New Mexico, and it's a pleasure for me to be with you today. So today we're going to be talking about hot topics in mental health. Specifically, we're going to focus on bipolar disorder. Bipolar disorder has been in my area of interest clinically, research, and teaching for the last number of years. So hopefully we can add value to your practice. When do you consider a long-acting injectable antipsychotic treatment for patients diagnosed with bipolar disorder? And we talked a little bit about it in one of the earlier questions. And again, would I think about an injectable early on? Probably it's not going to be the first thing that comes to mind in terms of treatment. Again, if in some circumstances, I definitely would be discussed. But the second episode is key, folks, because again, there's a 10% chance that it's single episode only. But once you have the second episode, that means that you have a recurrent condition. That means that the patient is going to need maintenance treatment. Frequent question that I get asked is, Doc, how long will I be taking this medication? My honest answer is until we find a treatment or a cure, rather. When we find a cure, we will be able to discontinue treatment. As we know, unfortunately, all the treatments that we have available now, they're not cures. They're just prevent relapse or just ameliorate symptoms. So back to the question, when do we consider a long-acting intramuscular injectable? Well, again, after the second episode, if the issue is clearly non-adherence, I would, of course, introduce to the patient and the significant others, family, there is a way that we can help with non-adherence. But a point that is key, folks, and this is a key take-home message today, is that we should not just think of long-acting intramuscular antipsychotics when there's non-adherence. Yes, non-adherence clearly is an indication to consider, but it could be, again, convenience. Many of our young patients go away for the weekend or with significant others, so they would prefer not to have to, remember or take a medication by mouth. So that's an option. Patients who change schedules, so is it morning, is it night, having an injectable? So I think it's important to bring it up not only as a response to non-adherence, but also other benefits that it might have for some of our patients. Folks, I hope that this presentation was helpful. If you have any questions, please send them to us. And thank you for being here with us today.